The fluorescent lights hummed their mechanical lullaby as Elena Martinez pushed the medication cart down Sacred Heart's pediatric corridor, moving with the kind of practiced invisibility that comes from learning to make yourself smaller than the rooms you occupy. 6 months. 6 months of letting her hands do the work while her mouth stayed shut, her history buried deeper than any classified file, her call sign nothing but dust in a Pentagon basement where they kept the things they wanted forgotten. The wheels squeaked beneath her, a sound like wounded animals crying out, and she didn't flinch. She never flinched anymore. Portland rain drummed against the corridor windows, the kind of relentless Pacific Northwest drizzle that made even the strongest people feel small. Elena's scrubs hung loose on shoulders that had carried too much weight and then lost it, fabric the color of faded concrete brushing against a body that had learned to take less space than it deserved. Beneath her uniform, against her sternum, a single dog tag hung on a broken chain, the metal cold and smooth like a secret she pressed her fingertips against sometimes at 3 in the morning when sleep wouldn't come. It wasn't hers. It belonged to someone she'd promised to keep saving people for, someone whose name she didn't let herself think about before her first cup of coffee because that's when her composure was thinnest. Room 304 sat at the far end of the ward, its door slightly ajar, late morning light spilling across linoleum that hadn't been properly waxed in weeks. Elena knew this because she'd scrubbed it on her hands and knees 2 nights ago when the night shift was short-staffed, and nobody had bothered to ask why the pediatric nurse was doing housekeeping work. That was fine. That was invisible. That was exactly what she needed. 7-year-old Maya Chen sat cross-legged on her hospital bed, her small frame silhouetted against the window, her hands moving in frustrated loops of American Sign Language that nobody on the day shift bothered to translate. Her chart, visible on the tablet attached to the foot of the bed, bore a series of damning clinical notes in Dr. Richard Ashford's precise handwriting: behavioral issues, non-compliant patient, possible malingering, recommend psychiatric evaluation. The assessments were clinical, professional, wrong in ways that made Elena's jaw tighten, that tiny muscle contraction being the only emotion she allowed to surface. Elena didn't knock. She signed, her hands moving with the muscle memory of someone who'd learned ASL the way soldiers learn to field strip weapons, with purpose, with precision, without hesitation. "Good morning, Maya. I'm Elena. What's your name?" The girl's entire face transformed. Her hands flew, a rapid, intricate sequence of signs that Elena's brain translated as pure relief. Maya spelled out her name in the air, Maya. Then she pointed to her throat and shook her head, a gesture that meant exactly what she'd been trying to communicate to a staff that didn't listen. The pain was here, the swelling was here, the infections kept coming here. "I know," Elena said, signing as she spoke the words aloud, a habit from her pre-classified life when she'd worked alongside interpreters. "I hear you. Show me where it hurts most." Maya's small fingers traced the outline of her neck, focusing on the left side beneath her jaw where the lymph nodes had swollen to the size of grape seeds. There was a subtle inflammation pattern there, a recurrent presentation that Elena had noticed on the charts across the past 72 hours, fever spikes at 2 a.m., followed by the administration of broad-spectrum antibiotics that improved symptoms temporarily but never resolved them, followed by discharge with a recommendation for behavioral observation. The pattern wasn't behavioral. The pattern was clinical. The pattern was a child whose immune system was screaming for help in a language nobody was trained to hear. Elena pulled out her phone and photographed the chart, not the official one but the personal journal she'd started keeping 6 weeks ago, a leather-bound notebook the color of old blood that she kept in her locker beneath her shift clothes and her regulation black shoes. She wrote, her handwriting small and precise, Maya Chen, 7-year-old deaf female. Recurring lymphadenitis pattern consistent with primary immunodeficiency disorder. For antibiotic response suggests inadequate immune response rather than infection recurrence. Swelling left submandibular node significant despite current amoxicillin clavulinate therapy. Recommend immunology panel, complement studies, hypogammaglobulin screening. The official chart, by contrast, read like a dismissal written in the language of authority: pediatric patient with documented behavioral issues presenting with somatic complaints. Recommend continued monitoring and psychiatric evaluation. No further workup indicated at this time. That notation had been written yesterday by Dr. Richard Ashford, the kind of doctor who inhabited hospitals like a king inhabited a throne, not because he'd built it, but because everyone had agreed to let him sit there undisturbed. 23 years at Sacred Heart. Board certified in pediatrics. Private practice with a 6-month waiting list. A man whose authority was the kind that calcified over time, turning from knowledge into something harder, something brittle. Elena knew the type. She'd seen commanders like that in the field, men whose competence had calcified into certainty, men who stopped listening because they'd convinced themselves they already knew everything worth knowing. Those men got people killed. They just did it slower in hospitals, one misdiagnosis at a time. Maya's father arrived at 11 o'clock, and Elena heard him before she saw him. The footsteps were distinctive, the gait of someone carrying weight that wasn't physical, the rhythm of a person whose body had learned to move with controlled precision because anything less might break something he couldn't afford to break. Commander James Chen looked like a man constructed from granite and regret. His Navy SEAL Trident insignia was a small brass point against his civilian shirt, but it was impossible to miss, the emblem of someone who'd spent his life solving problems that most people couldn't imagine, and now he was standing in his daughter's hospital room unable to solve this. Any change? He asked Elena, his voice carrying that specific cadence of men trained to deliver briefings, expecting responses in measured increments. Her nodes are still swollen, Elena said, keeping her voice level, professional, the voice of someone who stayed inside the boundaries of her position. She signed to me this morning that the discomfort is worse on the left side. The current antibiotic regimen doesn't seem to be addressing the underlying cause. Commander Chen's jaw tightened, a micro-expression, visible for maybe half a second, that told Elena he already knew this. He'd already fought this battle with the attending physicians. He'd already tried to explain to people with letters after their names that something was fundamentally wrong, and they'd smiled at him with the kind of certainty that comes from institutional authority rather than observation. Dr. Ashford says it's behavioral, the commander said, and the words carried the weight of something he'd been forced to accept even though he didn't believe it. Says she's manifesting stress-related symptoms. Recommends we consider psychiatric evaluation. Elena chose her next words the way soldiers chose their steps through minefields, one at a time, measuring each placement. Children with untreated primary immunodeficiency disorders can present with fever, lymphadenopathy, and recurrent infections. The behavioral presentation might be a secondary response to chronic illness, not the cause of it. The commander met her eyes, and Elena saw the exact moment he recognized something in her that he hadn't seen in anyone else on his daughter's care team. She was actually looking at Maya. Not at the chart, not at the diagnosis, not at the institutional framework that organized patients into neat categories. She was looking at the human being, the child, the specific small person in the bed whose lymph nodes shouldn't be swollen and whose hands shouldn't be desperate. "What would you recommend?" he asked quietly. "I'm a nurse," Elena said, and each word emerged measured, calibrated. "I can't recommend anything officially. But if I were reviewing this chart, I'd be interested in immunology consultation. CBC with differential, serum immunoglobulin levels, complement panel at minimum. Possibly genetic workup if the initial studies suggest primary immunodeficiency." Commander Chen nodded slowly. He'd heard this before from someone, probably the pediatric residents, and then had it systematically dismantled by Dr. Ashford's clinical authority. But he heard it again, now, and this time it came from someone whose voice didn't waver, whose hands didn't shake, whose entire presence suggested she wasn't offering an opinion, she was offering a fact. "If something happens to her," he said, the words dropping like anchors into still water, because someone wasn't paying attention to what I was saying, or what she was saying. "Nothing's going to happen to her," Elena said. It wasn't a promise. It was a statement of intent. After the commander left, he had to return to base, had to file reports, had to pretend his daughter was stabilizing when she wasn't. Elena spent an hour in the medical records room, pulling Maya's full chart, documenting the pattern of infections, cross-referencing the lab work, comparing dates and symptoms and medication responses against the standard clinical presentations for pediatric immunodeficiency disorders. The chart room smelled like paper and dust and the metallic undertone of filing cabinets that held secrets, medical histories that nobody read unless they had to, unless the diagnosis was already established, unless someone was actually looking. Elena was looking. She documented everything in her personal journal. She noted the specific dates, the specific medications, the specific responses that didn't match the behavioral hypothesis that Dr. Ashford had embedded in the official record. She worked with the kind of focus that soldiers develop in forward operating bases, that medics develop in trauma tents, that people develop when they've learned that missing details gets people killed. By the time the afternoon shift started, she had 17 pages of clinical observations that would never appear in any official record because that wasn't her job. Her job was to work within her scope, to stay invisible, to keep her mouth shut and her hand steady. That night, standing in the break room at the microwave, heating water for tea that she'd learned to make without sugar because she'd cut unnecessary things from her life the way she'd cut unnecessary movements from her medical procedures, Elena heard two nurses talking about Dr. Ashford's upcoming Grand Rounds presentation. He was planning a case study on pediatric somatization disorder, they said. He was using a new framework he'd developed to distinguish behavioral presentations from actual pathology. He was probably going to present the Chen case as an example of a child whose behavioral issues were masquerading as medical problems. Elena didn't react. She pulled her tea bag out, the water had turned a pale amber, exactly the color it needed to be, and carried it back to the nursing station, where she spent the rest of her shift documenting her observations in the official chart, each note carefully worded to remain within her scope of practice while building a clinical foundation that someday, when someone actually looked, would make the pattern impossible to ignore. Outside, the Portland rain continued its relentless percussion against the hospital windows, drumming a rhythm that sounded like warnings nobody was listening to. Morning rounds at Sacred Heart moved like a surgical strike, precise, hierarchical, unstoppable. Dr. Richard Ashford entered Maya Chen's room at 7:56 a.m. with 4 resident physicians trailing behind him like a formation of fighter jets, their white coats practically glowing under the fluorescent panels overhead. Commander Chen stood near his daughter's bed, his jaw set tight, watching the doctor approach with the wariness of a man used to reading threats. Maya sat up on her pillows, still in her hospital gown, her small hands already reaching for the communication board on her nightstand, the one Elena had positioned there yesterday so she wouldn't have to wait for someone to understand her. Elena stood by the vital signs monitor, her badge clipped to her scrubs beside the dog tag she wore under her shirt, close enough to the skin that no one could see it. She'd been documenting Maya's pattern since before dawn, temperature spikes at 4 a.m., elevated white cell count trending worse, the clinical signature of something systemic that behavioral therapy couldn't possibly treat. She'd written it all in careful, measured language in the chart. Clinical observations only. Scope of practice maintained. Nothing Ashford could use against her except the truth, and the truth had never been much of a weapon against men who'd built entire careers on looking busy instead of thinking deep. Ashford picked up the chart. His eyes moved down the page. She saw the moment he found her notes, his shoulders stiffened, his grip tightened on the aluminum clipboard, and his mouth pressed into a thin line like someone had just told him his mortgage was overdue. Nurse Martinez seems to have confused her nursing diploma with a medical degree, he announced, his voice carrying the kind of amplified clarity that made sure everyone in the room understood this was public humiliation, not private correction. He held up the chart so the residents could read her handwriting. This child has documented behavioral issues exacerbating routine infections. Behavioral. He let the word hang there like a diagnosis. Perhaps Nurse Martinez should focus on bedpans and let the doctors handle the actual diagnostics. One of the residents, a young woman with red cheeks, looked down at her shoes. Another one shifted his weight from foot to foot. They all knew. Everyone knew. Ashford was the man who'd built this hospital's pediatric reputation on the foundation of his own certainty, and certainty didn't tolerate questions. Commander Chen's jaw clenched so hard Elena could see the muscle working beneath his skin. His eyes went to Maya, who was watching the adults with the particular stillness of a child who'd learned that her deafness meant she missed the cruelty in tones but could read it perfectly in faces. Maya's hands had stopped reaching for the communication board. Her small shoulders had curled inward. That was what did it, not the insult aimed at Elena, but the way Ashford's words had made Maya smaller. Elena took one measured breath. Then another. The kind of breathing she'd learned in training, when keeping your composure under fire meant the difference between an extraction and a body bag. Her hands didn't tremble. Her face didn't flush. She'd learned long ago that tears could fall without permission, that the body sometimes had its own way of responding to injustice while the mind stayed locked in place, ice water calm. A single drop slipped down her cheek while her eyes remained steady on Ashford's. She wiped it away with the back of her hand, a gesture so controlled it looked like she was erasing dust. Dismissing a child suffering to protect your ego isn't medicine, she said quietly. The kind of quiet that makes people stop breathing. It's malpractice. The room held its silence the way a held breath holds pressure. Ashford's face flushed a deep crimson, not the flush of shame, but the flush of a man watching his authority questioned in front of his residence, in front of the Navy SEAL commander who stood between him and his reputation. He pulled out his tablet, tapped something with angry precision, and walked out without responding. One of the residents followed. The others glanced between Elena and Commander Chen, caught in the physics of a moment where the hierarchy had just shifted and nobody was quite sure where the fault lines ran anymore. Elena continued checking Maya's for line. Her hands were perfectly steady. That was what people didn't understand about composure. It wasn't the absence of feeling. It was the presence of something stronger. It was a spine made of reinforced steel and a nervous system that had learned fear didn't get to dictate movement. 30 minutes later, Elena entered the break room for lunch. She'd made herself a sandwich at 5 a.m. before her shift, turkey and mustard on wheat, the kind of functional meal that required no thought and provided fuel. She was unwrapping it when Sarah Chen, Jennifer Kovac, and Marcus Williams, 3 nurses who'd worked alongside her for the past 4 years, who'd laughed with her during the 2 a.m. chaos shifts, who'd covered her extra hours when her car broke down, gathered their lunches from the refrigerator in a synchronized movement that felt almost choreographed. They didn't make eye contact. They didn't speak. They just collected their food and walked out through the opposite door, leaving her standing alone by the microwave with her sandwich in her hands and the fluorescent lights humming their electronic monotone above her head. The abandonment was clean. Efficient. Professional. Elena set the sandwich on the counter and closed her eyes for exactly 3 seconds. Pain was information. That's what her combat medic training had taught her: localize the source, understand the mechanism, decide if the wound was survivable or fatal. This was survivable. This was just professional isolation, which was a weapon Ashford wielded like a surgical instrument because it didn't leave marks anyone could photograph. 3 nurses leaving a break room didn't violate any hospital policies. It was just the natural consequence of standing too close to someone the hierarchy had decided was expendable. She ate her sandwich alone, tasting nothing. At 1:55 p.m., she passed the unit board on her way to the medication supply room. The disciplinary action notice had been posted there with the casual efficiency of a kill order. Disciplinary action, Elena Martinez, overstepping scope of practice, insubordination, unauthorized medical recommendations. Final warning. The handwriting was Ashford's, aggressive, emphatic, each letter pressed so hard into the printout that the pen had nearly torn through the paper. 2 junior nurses, Rachel's daughter Emma, and a float from pediatrics named Douglas, read it while standing near the coffee station. Emma's eyes found Elena's for a microsecond before sliding away. Douglas didn't even acknowledge her presence. They gathered their cups and left without speaking, which meant the message had been distributed. It meant everyone now understood that proximity to Elena Martinez was dangerous, that she'd been flagged for termination, that the safest choice was distance. That evening, Elena arrived at the basement locker room, the one that hadn't been used for active staff in 3 years, and found her locker had been moved. Moved. Not reassigned through official channels that would generate paperwork. Just physically relocated to the opposite corner of the basement, beneath a ceiling panel that dripped every time it rained, isolated from the active staff lockers 3 floors above where everyone actually worked. Her name had been written on it in black marker, Martinez. She opened it. All her belongings were inside, transferred carefully enough that nothing had broken. her extra shoes, her backup stethoscope, the jacket she kept for the Portland winters. And there, wrapped in plastic at the bottom, the dog tag on the broken chain, Marcus's tag, the one he'd worn on their last mission together, the one she'd retrieved from the medical tent while his body was still warm. She held it in her closed fist. But that wasn't the worst part. Over the next week, Elena began to understand that Ashford wasn't just retaliating, he was systematically dismantling any structural support that might keep her standing. Her Thursday shift arrived with a printed schedule showing her reassigned to medication distribution in the pharmacy, administrative work, off the unit, nowhere near critical patients. When she checked the staffing board, Rachel, Jennifer, and Sarah had been moved to the night shift on different days, creating a scheduling matrix that made overlap mathematically impossible. She found herself working alongside new float nurses who'd received their briefing somewhere else, from someone else, and carried it with them like a virus. On Friday, she overheard Ashford on his cell phone in the hallway outside Maya's room. His voice dropped but not quiet enough. "David, it's Richard. That nurse I mentioned? I need you to expedite the board complaint review." "Yes, the one about scope violations. I have documentation." "Right. Monday." He was calling his former medical school roommate, the one who served on the hospital board. The one who owed him favors. Ashford had built this system the way architects build cathedrals, with intention, with precision, with the knowledge that it would stand long after he was gone. Elena walked past him without breaking stride. No reaction. No acknowledgement. Just a nurse moving through the corridors of the place she'd chosen to heal people, carrying the weight of a dog tag and the knowledge that fighting back inside the system was fighting with the system's weapons. When Maya was readmitted on Monday morning with her fourth infection in 8 weeks, Elena learned that she'd been specifically removed from the care team. She watched from the hallway as nurses who didn't know ASL tried to communicate with a 7-year-old girl signing desperately for the one adult who'd actually seen her. Commander Chen found Elena in the stairwell and asked directly, "Can you help her? Can you manage her case?" His voice carried the authority of someone used to command, the desperation of a father watching his daughter suffer, the frustration of a military officer encountering institutional logic that made no sense. Elena told him the truth. "I've been removed from her care." She didn't say why. She didn't need to. The notice was still on the unit board, 3 floors up, where everyone could read it. That night, Elena sat in her apartment in the darkness, the dog tag cold in her fist, and pulled out the folder she'd kept hidden in the bottom of her dresser. Inside were 73 pages of research, cross-referenced clinical observations of Maya's presentation, matched against autoimmune disorder patterns she'd documented during 3 tours in Sangin Valley, where endemic infections and immune compromise created a specific clinical signature that didn't match behavioral diagnosis. Hyper-IgM syndrome. Selective IgA deficiency. Autosomal dominant hyper-IgE syndrome. She had the references. She had the pattern. She had the cure, probably, if anyone would listen. But listening required authority, and authority had just announced, in writing, on a public board, with the formal power of the hospital behind it, that Elena Martinez was dangerous. Thursday morning arrived with the kind of silence that meant bad news. Elena pushed through the employee entrance at Sacred Heart, the October rain still clinging to her scrubs from the parking lot, and made straight for the scheduling board near the pediatric nursing station. Her name was there, but the assignments had shifted. All of them. Gone were the critical care rotations, the trauma cases, the complex immunology consults that had defined her work for the past 3 years. In their place, medication administration only. Non-critical flaws. The kind of assignment you gave to a nurse on her way out the door. She didn't flinch. Didn't reach for the board. Just stood there, reading the changes with the same stillness she'd learned in the field, the kind of composure that comes from understanding that every reaction was data, and data could be weaponized. Someone had moved fast. Ashford. It had to be. The timing was surgical, the precision unmistakable. He was tightening his grip, consolidating power before anything else could slip through his fingers. The break room smelled like burnt coffee and stale resignation. Elena filled her water bottle and read the notice posted on the bulletin board, formal, embossed, the kind of document that carried institutional weight like a loaded weapon. Formal complaint filed with Oregon Health and Science University Board of Nursing. Elena Martinez, RN. Allegations: performance of procedures outside scope of nursing practice. Insubordination and willful disregard of physician orders. The words didn't sting. They were meant to. Instead they felt like confirmation, proof that Ashford was running scared, that he'd seen something in Maya's case that terrified him enough to burn institutional capital, making her disappear. Major would have read this and smiled. The nurse Elena wore over her like a mask just nodded once and went back to work. By noon, the isolation was complete. Elena passed nurses Chen and Rodriguez in the hallway, both of them who'd expressed quiet support over the past week, both of them suddenly assigned to the surgical wing for the rest of the month. The shift supervisor, a woman named Garrett who'd been kind to her, was now working nights exclusively. The reassignments weren't random. They followed a pattern of surgical precision: remove every person who'd shown even the smallest kindness, fragment the support network, make Elena an island that no one could reach without risk to themselves. She understood the strategy. Ashford was no fool. He'd learned how to wield institutional power the way a surgeon wielded a scalpel, and he was demonstrating mastery now. Isolate the threat. Remove allies. Create a narrative of instability and overreach. By the time they actually terminated her, the rest of the staff would see it not as retaliation but as justified action. The real masterstroke came at 2 o'clock. Elena saw Ashford in the hallway with a man she recognized from hospital executive meetings, Dr. Timothy Bancroft, board member, connected, wealthy in the way that Portland's old money accumulated over generations in houses with names instead of addresses. They were talking quietly, their voices carrying the easy confidence of people accustomed to being heard without shouting. Elena could read Ashford's posture, shoulders back, head tilted slightly upward, the kind of body language that signaled victory already claimed. Bancroft was listening. More than listening, nodding. His hand came down on Ashford's shoulder in a gesture that looked casual but carried unmistakable meaning. Something had been agreed to. Something had been authorized. Later, she learned what. The emergency board meeting had happened during her medication rounds, held in one of the administrative offices on the 3rd floor. Just Ashford and Bancroft and the hospital's legal counsel. Quick. Closed. No documentation, no public record, but the outcome was already filtering through the nursing staff like contaminated blood through a transfusion line. Ashford had called in his medical school roommate, a man he'd roomed with at University of Washington 30 years ago, and that old friendship had translated into current institutional leverage. The board would support any action Ashford took regarding Elena. Not officially. Not yet. But the message was clear: he had cover. He had protection. He had the kind of power that only came from the right kind of history with the right kind of people. The notifications from the state nursing board arrived by certified mail at 4:30, just as Elena was clocking out. 3 separate complaints, each one detailed, each one damaging. Unlicensed practice of medicine. Administration of medications without physician authorization. Emergency cricothyrotomy performed by nursing staff without appropriate credentials. The language was surgical, each charge worded to imply recklessness, to suggest that Elena wasn't just overstepping boundaries but endangering patients. The complaints themselves were unsigned, routed through the hospital's legal department, officially lodged by Sacred Heart's institutional risk management team. Which meant they came from Ashford, but with enough institutional separation that they looked less like retaliation and more like legitimate safety concerns. She held the envelope for a long moment, feeling its weight in her hands like a sentence already passed. This was stage 4 of his escalation, not just social humiliation anymore, but strategic destruction with institutional machinery behind it. He was using policy as a weapon, authority as a shield, and friendship as leverage. And it was working. By the time the state board got around to investigating, her nursing license would be suspended pending review. By the time the review concluded, she'd be financially destroyed. The math was simple. The precision was perfect. The outcome was inevitable. Elena didn't drive straight home. Instead, she found herself on Route 99, headed south toward Forest Park, the afternoon rain coming down harder now, the kind of Portland October that turned everything to gray and rust. Her scrubs were still damp from the parking lot. Her mind was moving in loops. Maya, still undiagnosed, still untreated, still slowly dying from something that no one else could see. Commander Chen, carrying the burden of a daughter he couldn't help, trapped in the same institutional machinery that had now trapped Elena. And Marcus, 3 years gone, dog tag sitting in her locker in a chain that had broken during their last mission together in Sangin. Forest Park Cemetery sat on a hillside overlooking the city, marked by headstones that all said the same thing in different ways: here lies someone, and they're gone now. Elena drove past the main entrance and headed for the back, where the ground was less manicured, less visited. Where an Air Force officer and his wife could rest without too many people noticing who came to visit. She didn't feel the rain at first. Only the mud, soaking through her scrubs as she pulled the broken dog tag chain from her pocket. Marcus's tags. His name on the metal, not hers. Their last mission together had been supposed to be routine, air support for a SEAL extraction team in the Sangin Valley, coordinates already confirmed, intelligence already vetted. But intelligence fails. Confirmations dissolve. And when the mortar round came down 30 meters from where Marcus was providing fire support, it came with the kind of finality that didn't leave much to investigation. She'd written his name on a casualty report 14 years ago. She'd folded his uniform 22 times, regulation fold, sharp creases, the kind of precision that you could only learn by doing it for every person you'd lost. And she'd kept the chain that held his tags, because leaving them felt like betrayal, and burying them felt like abandonment. "I promised you," she whispered, her voice coming out rough in a way she didn't recognize. Rain was running down her face now, or tears, or both, indistinguishable in the downpour. "I promised you I'd keep saving people, Marcus. That was the deal. You went home to your grave, and I stayed in the fight. I stayed where I could help." The wind moved through the trees with the sound of distant rotor blades, the kind of noise that had lived in her nervous system for so long that it had become as natural as her heartbeat. She sat there, kneeling in mud that was turning her scrubs from white to brown, holding a chain that connected her to a man who couldn't answer anymore. "But I can't even save one little girl." The words came out broken, fractured in a way that her military training had taught her was weakness, had drilled into her to suppress, had made her understand as a liability. "She's 7 years old, Marcus. She can't hear. She can't get anyone to listen to what her body's telling them. And I could have fixed it. I could have saved her. But I'm just a nurse. And nurses don't get to save people. Nurses get to follow orders and accept humiliation and watch people die from preventable things while their supervisors protect their reputations." She pressed the dog tag chain against her chest, feeling the metal cold through the wet fabric. The cemetery around her was empty except for the names carved into stone, except for the dead who were too far gone to answer, too distant to help, too absent to do anything but witness. And then her phone buzzed. A text from an unknown number, actually not unknown. She recognized the area code immediately. 206, Seattle. Military. "This is Captain David Holloway, NCIS. Sacred Heart reported a complaint to the Navy about a nurse involved in a SEAL family's care. I'm coming to Portland. Bring everything." "Holloway?" Elena looked at the message for a long moment, feeling something shift in the machinery of her defeat, some small gear turning in a direction that didn't lead downward. She typed back 3 words: "I'm ready. Come fast." Then she put her forehead down in the rain and let herself breathe. The bronchoscopy was scheduled for Tuesday morning at 9:15. Elena learned about it from the surgical board, not from Ashford, who'd made a point of excluding her from all clinical discussions about Maya. She stood at the nurse's station pretending to chart vitals while her eyes tracked the procedure room preparations. Room 4. Sterile field already laid out. Anesthesia cart positioned with the precision of someone who'd done this 1,000 times. The child would be sedated. The scope would go down her throat. Video images would appear on the monitor to show exactly what was causing the chronic swelling and infection. Straightforward procedure. Standard protocol. Except Elena had read the chart 3 times and nothing about Maya's presentation was standard. She positioned herself near the procedure room's observation window at 8:55. Not in the room, that would trigger immediate confrontation, but close enough that she could see through the glass partition. Other nurses gave her a wide berth, their movements deliberately angling away as they passed. The isolation had become complete. No one spoke to her unless required. No one made eye contact. It was like existing in a room full of people who'd agreed, silently and unanimously, that she was invisible. The loneliness of it was a pressure against her ribs, but she locked it down. Pain was information. Information was power. Maya was wheeled in at 9:08, small and anxious in her hospital gown. Commander Chen followed behind, his seal posture rigid, helplessness etched into the line of his jaw. Elena watched him grip the edge of his daughter's stretcher as if touch could anchor her to safety. Dr. Ashford entered last, his white coat pristine, his confidence radiating like heat off concrete. He didn't glance toward the observation window. He moved to Maya's bedside with the authority of someone who'd never been questioned in his life. The anesthesia began at 9:15 exactly. The child's eyes flickered. Her body relaxed. The scope went in smooth and practiced. Monitor showed normal tissue, normal mucosa, nothing that explained the pattern. Elena's hands were steady as she watched, her military training activating the same calm that had steadied her in field hospitals under mortar fire. Something wasn't adding up. Something was missing. The immune markers in Maya's blood work, the timing of the infections, the pattern of swelling, it all pointed to one specific diagnosis that no one was looking for because they'd already decided she was fine. Then Maya's chest seized. Elena saw it before anyone else registered it. A subtle tightening. A catching of breath. The monitor's oxygen saturation line began its descent. 91. 88. The child's airway was swelling. Not from the scope, from anaphylaxis. Her immune system was attacking itself in response to something in her body. Elena's eyes went to Ashford. He was staring at the monitor with the expression of someone who'd just been presented with data that contradicted his diagnosis. His mouth opened. He didn't move. He didn't call for anything. Elena moved. She was through the procedure room door before conscious thought could catch up. Her hands were already moving on muscle memory, 16 years of field medicine screaming that an airway in crisis waits for no one. 84. 80. Maya's lips were turning blue. Her small body was beginning to seize. The attending physician, some younger doctor named Morrison, was reaching for the crash cart, but Elena was faster. Ballpoint pen. 14 gauge for catheter. Now. She didn't ask. It wasn't a request. It was a command with the weight of someone who'd done this with nothing but field dressings and the threat of death as backup. Morrison grabbed what she needed. The sterile field was contaminated now, but she didn't care about protocol, she cared about the child's airway. Elena's hands moved with the terrifying fluid precision of someone performing field surgery under fire. She palpated the cricothyroid membrane. Located it by feel alone. The pen's hollow ballpoint barrel became a makeshift tube. The forecatheter created a passageway. 90 seconds. That was all it took to open the airway and let oxygen flow. 74. 78. Climbing. Epinephrine. 0.3 milligrams, 4 push. Then we push the specific autoimmune cocktail. Methylprednisolone, 2 grams. Diphenhydramine, 100 milligrams. Do it now. Elena's voice was ice in the warm room. The staff moved. The dosages went in. The medication she'd been mentally cataloguing for weeks flowed into Maya's small veins. The medications that Ashford had never considered because he'd never actually listened to the data. 81. 85. 90. Maya's body began to relax. The seizure stopped. Her oxygen levels stabilized. Her eyes fluttered open, unfocused and terrified, but breathing. The child's small chest rose and fell in the rhythm of survival. Elena released the breath she'd been holding, and something in her chest that had been wound tight since that first day with Maya unclenched just slightly. Then Ashford spoke. His voice was steady but hollowed out, all the confident authority gone. "Clear the room. Now. Everyone except nursing." He didn't look at Elena. He wouldn't meet her eyes. In that moment of avoiding her gaze, Elena understood that he'd made a choice. He would not acknowledge what had just happened. He would not thank her. He would not admit that she'd saved his daughter's life while his hands remained frozen in indecision. She turned and left before anyone could ask her to. The retaliation began before the sun set. Dr. Ashford moved with surgical precision over the next 48 hours, each action calculated and deliberate. He called an emergency meeting with Dr. Marcus Sterling, his medical school roommate who sat on Sacred Heart's board of directors. Elena learned this from Jennifer, the one nurse who still whispered information to her, that Ashford had presented a carefully curated narrative. A rogue nurse. A pattern of insubordination. A woman who'd bypassed chain of command and performed an unauthorized cricothyrotomy, a procedure completely outside her scope of practice. He produced documentation of her challenges to his diagnoses. He highlighted her statements about his competence in clinical meetings. He'd even obtained the security footage from the procedure room, edited to remove the 20 seconds when he stood frozen while a child turned blue. The edited version showed only Elena's intervention, disconnected from the medical necessity that had driven it. He filed formal complaints with the State Board of Nursing. He met with the hospital's legal team, framing her as a liability risk. He reassigned every nurse who'd ever spoken to her. He locked her out of the electronic medical record system while citing administrative review protocols. Each action was professional. Each was calculated. Each was designed to build an unassailable case that Elena Martinez was a threat to institutional authority and therefore had to be removed before she could testify about what she'd actually seen and what she actually knew. 2 days after the code, Elena was called to the main nurse's station for a certified letter. Her hands didn't shake as she opened it, though the word swam in front of her eyes like something drowning, immediate dismissal pending investigation. Your employee file has been placed in status of administrative separation. You are required to surrender all hospital credentials and be escorted from the premises by security. The walkout was the longest 30 meters of her life. 2 security guards flanked her, not because of any threat she posed, but because that was the protocol for terminated staff. Everyone was watching. The nurses she'd worked shifts with, saved lives beside, covered for when they were running late, they stared at their computer screens as she passed. No one made eye contact. No one said goodbye. The isolation she'd been experiencing crystallized into something concrete and official. She was gone. She was erased. She was the nurse who'd overstepped, who'd challenged authority, who'd had the audacity to question Dr. Ashford's judgment and paid the price for it. They walked past Maya's room. Elena kept her eyes forward, military training overriding every human impulse to glance through the window. But she felt Commander Chen's gaze. She felt his understanding in the weight of that look. His daughter was breathing because Elena had acted. His daughter would live because Elena had refused to wait for permission. And now Elena was being removed from the hospital for exactly that action. The box with her locker content sat on the security desk. Her personal items. Her stethoscope. Her trauma shears. And resting on top, catching the fluorescent light like it was the only real thing in the room, a single dog tag on a broken chain. Marcus's dog tag. The one thing she kept with her always. The one thing that reminded her that some promises were worth dying for. She took the box without speaking. The guards walked her to the employee exit. The door slid open to Portland rain, cold and relentless, the sky the color of old concrete. Elena stepped into it without hesitation, letting it soak into her clothes, into her hair, into the spaces where her composure had cracks. That night she would kneel at a grave in Forest Park Cemetery. The rain would wash away her tears. She would hold a broken dog tag and whisper words to a man who couldn't answer. She would tell him she'd failed. That she'd saved the girl but lost everything else. That some promises were harder to keep than she'd ever imagined when she'd made them on a desert highway 1,000 years ago, in a different life, wearing a uniform that meant something. But that moment would come later. For now, there was only the rain and the long walk to her car and the understanding that true class, the kind that actually mattered, was exactly what you did when the lights went out and no one was watching and no one would ever know. 3 weeks passed like water draining from a broken vessel. Elena existed in that space between survival and something that resembled a life. Her apartment became a holding cell, a termination letter a constant weight in her pocket alongside Marcus's dog tag. The State Nursing Board investigation dragged through depositions and paperwork while Sacred Heart's administration circled wagons and lawyers. She'd applied to 3 other hospitals. All politely declined. Word traveled. Ashford had made sure of it. The basement locker room at Sacred Heart was where she'd come that afternoon, permitted entry only to collect the personal items left behind when security escorted her out. Her scrubs hung unwashed, still holding the shape of her shoulders. She folded them methodically, mechanically, each movement a small erasure of the person she'd been here. The fluorescent panels above buzzed their endless monotone. She was pulling her old trauma shears from the metal shelf when the overhead intercom crackled. Code Blue, Emergency Department. Trauma Bay 4. Code Blue, Emergency Department. Her hands went still. Then the second announcement, voice strained and urgent, pediatric patient. 7 years old. Multiple seizures. ETA 2 minutes from transport. Elena didn't think. Muscle memory took over, the same instinct that had moved her hands in Sangin Valley when the 82nd Airborne Convoy lost its medical sergeant to shrapnel. She dropped the shears, moved toward the stairs, then stopped at the door to the main corridor. She wasn't cleared. Wasn't authorized. Wasn't even supposed to be in the building except to retrieve her things. The logic of hospitals, hierarchy, credentials, chains of command, all the structures that had betrayed her, all rose up in that doorway like an argument. Maya Chen came first in her thinking. Not protocol. Not consequences. Not the FBI investigation or the legal notices or the termination letter signed by a board she'd never directly challenged. She moved. The trauma bay doors burst open and the world became velocity. Commander Chen wasn't carrying his daughter, a paramedic was, her small body rigid with seizure, her lips the color of old bruises. The portable monitor showed heart rate 168, blood pressure elevated, O2 sat holding at 71% despite supplemental oxygen. Dr. Marcus Webb, the attending, was already calling orders to residents who moved with the chaotic precision of people trained to manage disaster but not to think through it. Nobody noticed Elena slip into the bay's corner. Nobody noticed her reading the monitor, reading Maya's posture, reading the clinical data written in the child's convulsing body like a language only one person in that room actually spoke. The seizure broke. Maya's eyes opened. For 1 perfect second, her small hands moved in rapid ASL, Major Reaper. The room froze. Not because a deaf child's hands could form the call sign of a Navy SEAL. But because Elena's response was instantaneous, her own hands moving in perfect fluid sign, I'm here, Maya. You're safe. And the most dangerous part wasn't the sign language. It was that Elena stepped forward without permission and said to Dr. Webb, voice dropping 2 octaves into something that sounded like command, IVIG. 1 gram per kilogram for push. Methylprednisolone 30 milligrams per kilogram. She's in immunological cascade, the seizures are neuroinflammatory, not idiopathic. She didn't wait for authorization. She was already moving toward the medication cart, her hand steady as a surgical laser, her movements precise in the way of someone who'd administered drugs in firefights. 14 gauge 4. Push wide open. A resident reached for the IVIG. Dr. Webb, should we do it? The voice came from the doorway. Commander Chen stood there, his frame taking up space, his eyes tracking Elena with the intensity of a man who'd learned to identify threats and allies in milliseconds. "That's Major Elena Martinez. You follow her orders." The room shifted. The air pressure changed. Elena's hands didn't shake as she administered the infusion, watching the monitor like it was a weapon system, O2 climbing from 71 to 74, then 78. Maya's breathing steadied. The seizure activity flattened. Her eyes, when they opened again, found Elena's with a clarity that had been absent before. She moved her hands again. "You saved me." Elena signed back, "You were never in danger. I was always here." That wasn't true. It was the first lie Elena had allowed herself since arriving at Sacred Heart, and it was the most important one she'd ever told. The door to the trauma bay opened. A man in a Navy service dress blue uniform entered, not hospital staff, not administration. Behind him came another in the same uniform, and they carried themselves with the particular gravity of people accustomed to rooms stopping when they arrived. The first man approached Elena as she finished the second methylprednisolone push. His voice cut through the monitors and urgent breathing. "Major Elena Martinez. Call sign Reaper. Silver Star recipient." Elena didn't turn. She was still tracking Maya's vitals, still reading the child's recovery in real time. She'd learned long ago that acknowledgement could wait. The patient came first. Always. "Your classified commendations from Operation Enduring Freedom have been flagged in our system," the officer continued, his tone formal and precise. "You pulled for Marines out of a mortar-kill zone in the Sangin Valley. You treated 16 combat casualties in a forward operating base with 0 surgical support. You were medevaced from that location after receiving shrapnel fragments yourself." Commander Chen stepped closer to his daughter's bedside, his voice breaking like something brittle under pressure. She knew. The entire time, Maya wasn't behavioral. She wasn't being difficult. She had an autoimmune condition that was causing seizures. "And I brought her to Ashford anyway because he was supposed to be the best." His fists clenched. And she knew. She knew because she's trained to see what others miss. Because she saved lives when everything was falling apart. Jennifer, the floor nurse who'd run Elena's military databases 3 weeks earlier, was standing at the medication cart with her hand trembling. She pulled up another screen, Elena's official service record, flagged for clearance and showing only redacted sections. 2 bronze stars, Jennifer read aloud, her voice unsteady. "Purple Heart. There's something here about a presidential unit citation, but the text won't load, it's still classified." The second officer in dress blue stepped forward, his bearing military in a way that made the hospital staff instinctively straighten. "I was with her in Helmand Province. My team took small arms fire from a compound at 0400 hours. Our medical sergeant went down, compromised femoral artery, bleed out timeline of 4 minutes maximum. Our commanding officer was hit. Our radio operator was down." He paused, and when he continued, his voice was pitched for the entire room to hear. "Major Martinez performed a tourniquet application while returning fire from a 240 Bravo machine gun with one hand. Then she dragged 4 of us out of the compound under active fire and called in a medevac under her own fire cover." 2 bronze stars. Purple Heart, twice over. And a classified presidential unit citation that I still can't talk about because the operation files are still sealed. The room went so quiet you could hear the ventilators hiss. Elena's hands were still on Maya's full line. Her face showed nothing. No tremor, no reaction, no acknowledgement of the gravity well that had just formed around her identity. She glanced at the monitor, O2 sat now 88, stabilizing. She adjusted the drip rate with the precision of someone recalibrating equipment under fire. "Her autoimmune response is stabilizing," she said quietly to no one in particular. "Repeat labs in 30 minutes. CSF analysis if the next seizure event triggers. Otherwise, she should be stable for transfer to pediatric ICU for 24-hour observation." The trauma bay doors opened again. 2 people in tactical gear and FBI windbreakers entered with the particular authority of federal agents who'd already called ahead. The lead agent, woman, sharp eyes, call sign quality demeanor, approached the nursing station where Dr. Ashford had somehow materialized, his white coat immaculate, his face arranged in confusion. Dr. Richard Ashford, the agent said, producing credentials that glinted under the fluorescent lights. We need to talk about falsified documentation submitted to the Oregon State Nursing Board regarding Major Elena Martinez. Ashford's jaw tightened. I reported legitimate scope of practice violations. You forged her medical records, the second agent interrupted, pulling out a tablet displaying side-by-side documents. We have the original security footage from room 412 from 3 weeks ago. We have your edited version submitted with your complaint. In the original, you stood motionless for 23 seconds while Major Martinez performed an emergency cricothyrotomy to save your patient. In your edited version, you removed those 23 seconds entirely. The first agent moved closer. We also found 19 other instances of systematically falsified complaints against staff members who challenged your diagnoses. 11 of them have already contacted our office. 7 of those had to leave their profession entirely. She reached for handcuffs. You're under arrest for federal fraud, falsification of state medical board documents, and conspiracy to obstruct a federal investigation into a military personnel matter. Ashford's voice rose. I was protecting patient safety from a nurse overstepping her authority. A nurse? Commander Chen's voice cut through like a blade. A major in the United States Navy Medical Corps who has saved more lives than you've diagnosed in your entire career. You refused my request to have her on my daughter's care team. You prioritized your ego over a child's life. The handcuffs clicked. Ashford's face went pale as the agents turned him toward the exit, his white coat stark against their tactical gear, the symbol of his authority suddenly transformed into evidence. He walked through the trauma bay with security flanking, and Elena could hear the whispers starting already, residents pulling out phones, nurses gathering at doorways. The lead FBI agent turned to address the assembled staff. Dr. Ashford's actions represent a pattern of institutional abuse dating back 15 years. We're recommending full criminal prosecution to the Department of Justice. His medical license is recommended for permanent revocation, pending outcome of state review. Any of you who experience similar retaliation, falsified documentation, or career interference, our contact information will be posted at every station in this hospital. Commander Chen approached Elena, his eyes carrying the weight of 3 weeks of his daughter fighting for her life while the system failed her. I asked you to help her. You did. I sent you away because the hospital told me to. I'm sorry. Elena glanced at Maya, who was now resting, her small body finally free from the electrical storm that had ravaged her nervous system. She signed to the child, "You're brave, Maya." The child's hands moved in response, "You're the real hero." Elena felt something shift in her chest, not hope exactly, but the memory of what hope felt like. She turned to Commander Chen and said simply, she needs to stay on the immunosuppression protocol. No deviations. The seizures will return if you miss even one dose. I know, Chen said. Because you explained it. Because you saw what nobody else could see. 2 years passed like time suddenly flowing forward at normal speed again. Elena was offered her job back within 72 hours of Ashford's arrest. She declined. Instead, she proposed something to Sacred Heart's administration, something that didn't exist yet. A pediatric immunology department with diagnostic authority, treatment protocols, and a teaching curriculum for nurses willing to challenge institutional hierarchy when patient welfare was at stake. They gave her a corner of the 4th floor and a budget that started small but grew with each diagnosis she made that others had missed. The 19 staff members Ashford had systematically destroyed began returning. Sarah, the nurse from the break room, asked to work under Elena's supervision. Jennifer took the position of head nurse, coordinating the ASL training program Elena insisted on, because deaf and hard of hearing patients deserve to see themselves reflected in the people caring for them. A scholarship was established in Elena's name for nurses pursuing advanced immunology training, funded by Commander Chen himself. Dr. Richard Ashford served his federal fraud sentence in a minimum security facility and was later employed as a night security guard at Sacred Heart's loading dock, the only position the hospital could legally offer him, given his permanent license revocation. Elena saw him sometimes during her late shifts, his pale blue uniform a constant reminder of institutional consequences. He never met her eyes. On Maya's 10th birthday, Elena's office wall displayed a framed photograph of the girl signing "Thank you" with perfect clarity, her autoimmune disorder now managed through Elena's treatment protocol, her hearing aids decorated with superhero stickers. Beside it, in a shadow box, rested the dog tag on its broken chain, the clasp professionally restored, the chain mended, displayed next to Elena's Silver Star citation and a photograph of Marcus in his Navy SEAL uniform. Maya visited the department monthly for follow-ups, her progress measured in stability, her voice, through sign language and written communication, growing stronger with each appointment. Commander Chen funded the scholarship formally, establishing it as an endowment. He attended Elena's lectures, sitting in the back of the conference room as she taught new nurses about the cost of silence, about the courage it takes to advocate when hierarchy forbids it, about the particular strength required to see what others dismiss. Elena still visited Marcus's grave, but no longer in rain and desperation. She kneeled in sunshine, touching the headstone with hands that had learned to hold both grief and purpose simultaneously. "I kept my promise," she said quietly. "I'm saving people. And now I can do it in the light." As she walked back to her car one evening, her phone buzzed with a message from a hospital in Seattle, another case that every doctor had given up on, another patient dismissed as behavioral or untreatable. She typed her response and drove back toward Sacred Heart, the sunset catching her dog tag as she moved through the main entrance. A junior nurse stopped her in the hallway with a difficult case, and Elena nodded, already moving toward the stairs. In the elevator, she caught her own reflection and remembered what Marcus used to say, the line that had become the closing words of every lecture she gave to nurses willing to find their voice: "True class is what you do when the lights go out." If you found yourself holding Elena's position, if you've ever been dismissed or silenced in a workplace that demanded obedience over patient welfare, please subscribe for more stories of the quiet warriors who refuse to disappear. Like this video and comment, what would you have done if the hospital system turned against you? Let's talk about the cost of speaking truth.